All right, here we go. Good morning. Thank you for joining us today. My name is Lisa Reese, and I'm with the Health and Wellness Outreach Program here at RX Outreach. Our mission is to provide affordable medication to those in need. If you or anyone you know is struggling to pay for your prescriptions, please reach out to me afterwards or visit our website, which is www.rxoutreach.org, to see what medications we carry and enroll for free. Today, we will be learning about managing and preventing hypertension. This is one of our weekly sessions in a series of free community health education webinars led by medical professionals and experts. If you'd like to see what topics are coming up soon, you can visit the Health and Wellness Outreach page at rxoutreach.org. These sessions are recorded and uploaded to our YouTube page, so you can go back and review them or send them to a friend. To find them, you would just go to YouTube and search RX Outreach, and you'll find our page that way. Our webinars would not be possible without our sponsors. Their support enables us to provide this resource to the community at no cost. Thank you to our presenting sponsor, which is Pfizer Rx Pathways. In addition to supporting our health and wellness outreach program, Pfizer Rx Pathways is a patient assistance program that can connect you with resources for support with insurance, help with copays, and find medicine you need for free or at a savings. I'd also like to thank our sponsors who have helped to make this series possible: Anthem, Cigna, Bridgeton Landfill Community Fund, Project Fund, Lutheran Foundation of St. Louis, and Marillac Mission Fund. Okay, just a little Zoom housekeeping note. If you have any questions, please submit them in the chat, which is at the bottom bar on your Zoom screen, and we will address them at the end of the presentation. Okay, so without further ado, I'd like to introduce our speaker today, Paula Linden. Paula has her MSN and is an RN. She is an assistant professor of nursing at St. Louis Community College. She has a wealth of experience, and we are so very grateful to have her here with us today. Paula, I'm going to switch the controls over to you. If you can bear with me for just a second here. Share screen. And I will put this in presentation mode. And you should have mouse control now. Let me know if you don't.
Okay. Can you see it as the large presentation?
I see it. Yes. Can you?
I see it too. Yes,
okay.
I do.
I'm going to mute myself and take it away. Thank you so much.
Okay. Thank you. And I want to welcome all of you, especially you, Katie, to this presentation on managing and preventing hypertension. Hypertension is probably the main health concern for the world population. So most people, if they're going to have a disease process, they are going to usually start with hypertension. Find my next button. Okay, so I always like to start out with a little bit of anatomy and physiology. I think that having that visual helps you have a better understanding. So the parts of our body that are involved in hypertension are our heart and our vascular system. I don't know why it's jumping like that. I'm going to go back. Sorry about that. Heart vascular system, just a basic definition of what hypertension is. It's a condition in where the pressure within your heart and your blood vessels in particularly is above a normal range. Okay, I'm not really sure why this is skipping so fast. I'm going to try and go back. I apologize. Gremlins, we've had gremlins today. Okay. I'm going to start with anatomy. As you can see on the right side, there's a picture of your heart and your blood vessels. So the blood vessels that are in red are your arteries, and what they are responsible for is carrying blood that has oxygen to your organs and your tissues. And then you'll note that the blood vessels that are in blue, those bring blood back from your organs and tissues to your heart so that they can collect more oxygen and complete that cycle of taking blood and oxygen to your tissues and taking waste products and CO2 back to your heart and your lungs. So our heart normally exerts a pressure. So it's like a muscle, mostly muscle, and it will squeeze like this. And as it squeezes, it exerts a certain amount of pressure to be able to pump blood through your whole entire body and back to your heart again. What happens as we age, or if we have certain disease processes like atherosclerosis, um, the vessels become kind of crispy like as we age, and they narrow, which if you think about having to push something, force against a resistance, like when you're blowing up a balloon, the more resistance you have, the increased pressure you have to exert to be able to get either air, like in a balloon, or blood, like through diseased vessels. You have to increase the pressure with which you're forcing that either liquid or air through. So just exerting that higher amount of pressure can damage the very delicate blood vessels, especially like the lining. So that's what we're going to call hypertension. Okay, again, it's a increased force. Why is it doing this? Increased force. There are two types of hypertension. There is primary hypertension, which is the most common. Some people also will hear the term idiopathic, meaning we can't really find a cause. 90 to 95% of all hypertension is this type. Typically, it's developed by aging. Again, we talked about hypertension. If your blood pressure is high, it's sort of cyclical. This is going to make me crazy. I'm going to go back. I'm sorry. So there's no known cause. Here's some contributing factors. People that smoke and how smoking contributes to that is the main ingredient in cigarettes is nicotine. That causes constriction or makes your blood vessels smaller. So if you think about your smoking, you have a chemical in your body that's making your blood vessels smaller. Your heart's going to have to increase the pressure or the force that it's pumping just to get the blood through your vessels, and that can cause damage. Secondary hypertension is usually associated with another disease process that causes hypertension. So usually that's kidney disease. Some regulatory factors for your blood pressure is something that starts at the beginning of your heart that we call preload. That has to do with the amount of blood volume, basically, that's trying to get in your heart and through your heart. So if you have kidney disease where your kidneys don't regulate your blood volume and the water within your body, you can have too much water that your heart is trying to pump through your bloodstream. I'm trying to make this simple. Pump through your bloodstream so that with all this excess water, that creates extra work on your heart, and your heart has more volume to pump through. So some primary risk factors for hypertension is once you're above the age of 50, because our heart has been used for 50 years, our blood vessels are rather sensitive. They can become damaged just from having to use them for 50 years. Or if you've had a systolic blood pressure, which means systolic is your blood pressure in your heart while it's working. So that's the top number. The diastolic blood pressure is the bottom number, which is an indicator of the pressure in your heart when it's not pumping. So your normal heartbeat is a lub-dub. And so the lub is when you're squeezing, and the dub is when it's at rest. So that's how you measure a person's blood pressure. The systolic blood pressure will be the top number. That's the working number of your heart. The bottom one, the diastolic, is the non-working. So if you're concerned about your blood pressure, usually the bottom number, the one at rest, is the one usually that physicians pay a lot of attention to, because they don't want the pressure in your heart to be really high when it's supposed to be resting. Alcohol intake is another thing that can contribute to high blood pressure, as is tobacco use. We talked about nicotine and tobacco being a vasoconstrictor. Diabetes and hypertension. People that have high or uncontrolled blood sugars, the high and uncontrolled blood sugar can damage your blood vessels. If you have high cholesterol, that's like a sticky substance that narrows the lumen of your blood pressure. Again, then there's more force that your heart has to work against. Sodium in your diet increases your blood pressure. If you think about how water follows salt, back in your chemistry lesson. So if you have a high level of salt in your diet, which then from your stomach goes to your blood vessels, it's going to keep or attract water. So then we're going to have a higher, again, what we call preload on your heart. So we're going to have more water volume in our bloodstream that our heart is expected to pump. Because we have a heavier load, it's going to take more force to push that volume through your bloodstream, thus increasing your blood pressure and having extra stress on your vasculature tree. Women, hypertension is more prevalent in males. However, women of certain ethnicities, African American women are more at risk for hypertension. I think it's interesting to show that research has shown a different genetic link for causes of hypertension in our African American community. And it's interesting that they respond better to different types of antihypertensive medications, which we'll talk about. Other risk factors are obesity, if your BMI is greater than 25. If you have a family history of hypertension, meaning your parents or siblings. We talked a little bit about ethnicity already. If you have a sedentary lifestyle where you're not getting a lot of regular exercise, different socioeconomic status, which really relates to diet and health promotion. And again, stress is a huge factor. So there is a chemical link between stress where when you have a stressful event, your body releases cortisol. And so the cortisol, and I'm sure some of you have heard about cortisol and diet and obesity. The cortisol increases your stress hormones, which then sets up this whole chain reaction of how your body responds. So it sends out basically a stimulant, which then the stimulant causes the vasoconstriction, similar to what the nicotine does. Makes your blood vessels smaller, and your heart has to push harder against your vasculature to get the blood through. So that's another thing that causes hypertension. So again, things you need to know about the pathophysiology is there's a genetic link. They found genetic links. So if your parents have hypertension, you're more likely to have hypertension, as are your children. As you age, some people will have sodium and water retention, where again, you're increasing that preload or the pre-work on your heart because you're sending through this tidal wave of water. The RAS system, again, has to do with your kidneys. There are certain chemicals in our body that would cause us to either save sodium and water in our kidneys or release it. People have a problem with people with hypertension sometimes do not have the correct enzymes and things for this system to work properly. Diabetic patients who have high blood sugars or low insulin levels are at risk for developing hypertension. We're not going to talk about the endothelium dysfunction, but again, stress and synthetic nervous system activity, where if you're one of those hyper people that which I myself am, where you're always running on your adrenaline, or you have to have all of this caffeine. Those are things that can increase your risk factor for hypertension, or basically giving you the disease because of the constant vasoconstriction, which then eventually damages your blood vessels over time. Okay, I'm not going to hit the thing too many times because then it probably advances. Okay, so complications. So when we talk about complications of hypertension, we're going to think about, where does our blood go? So our blood goes to all of our major organs and our tissues, but the top primary organs that are going to be affected by our heart hypertension are going to be our heart, our brain, our blood vessels, our kidneys, and our eyes. So if we have high blood pressure and our those veins and vessels become damaged to those organs, they're not going to function properly. So if we think about hypertension in our heart, it can affect the valves of our heart. It primarily affects the coronary arteries, which are on the outside of our heart. Their job is to supply blood and oxygen to our heart tissue so that it keeps pumping. People that have hypertension, how it affects the brain, are typically, you will see those people have strokes. Either they will have clotting strokes or they can have bleeding strokes. People with peripheral vascular disease, those are people that develop poor circulation in their legs, their feet. You'll see a lot of swelling. They can have clots. People that have hypertension that affect their kidneys means that they can actually end up with kidney failure. So they'll have to be on dialysis or kidney transplants. And then people that have hypertension that affect their eyes, they can have macular degeneration. They can have tiny clots that affect the circulation of their eyes and eventually lead to blindness. So what is your doctor going to do to diagnose your hypertension? Well, the first thing they're going to do is they're going to take your blood pressure. And typically what they do is they take your blood pressure in both arms and then they compare the difference. So if you show up at your doctor one time and your blood pressure is 150/90, they are not going to diagnose you with hypertension. What they're looking for is a pattern of elevated blood pressure over time. So if you show up to your doctor and your blood pressure is a little high, what they'll do is they'll talk to you for a little while, give you a chance to kind of settle down, because nobody likes to go to the doctor. Take your blood pressure again. If it's still a little bit high, what they'll do is send you home and have you take your blood pressure at regular intervals at home and create a diary. And then your doctor will bring you back and talk about, okay, what does your patterned blood pressure look like? They can also do some blood tests looking at your kidney function. Remember, we have primary hypertension, which a lot of times it's caused with aging, or we don't really know the cause of it. We know contributing factors, but we don't know for sure. However, with secondary hypertension, we know that kidney function is usually the contributing factor to elevated blood pressure, or to restate that, poor kidney function. So they'll do a urinalysis, they'll do blood work, we'll look at your BUN, which is a lab that tells how well your kidneys are functioning. They'll also look at a creatinine level and a GFR, or a filtration rate of your kidneys. They'll look at some of your electrolytes, make sure your blood glucose isn't elevated. They'll look at your cholesterol levels and your lipid profile to see if you're at risk for atherosclerosis. Um, Sometimes they look at uric acid levels. They do an EKG, an echocardiogram, just to look at your heart. So they look at the whole vascular system to try to determine what's going on and what's the cause. Um, Again, blood pressures in both arms. Sometimes they'll do more invasive blood pressures. They'll have you ambulate, they'll have you sit, they'll have you stand. Again, important things, important things to do. They will send you home with hopefully one of those blood pressure cuff monitors that are not really connected to anything. It's all contained in one system. Those blood pressure machines that you can go to Walgreens, those aren't terribly accurate. They can kind of give you an idea, but doctors, they won't make a diagnosis off the blood pressure machine at Walgreens. So typically they'll have you get one of those little mini cuffs that you can use at home. So I want you to remember the important thing about any healthcare decisions you're making or disease process that you have is that it's a team. It should be a team effort between you, your physician, a dietitian, because we'll talk about diet, how important that is, your pharmacist, because they will help you understand any kind of medication concerns that you have, any questions that you have. So I want you to always remember that this is a team or collaborative approach. So I know baby boomers like myself, we have that mentality or mindset that certain people in our lives are authorities and what they say is always right. But I kind of want to change that mindset that we're all in partnership together to help you live as long as possible and in a healthier, more fulfilled state. So I want you to remember that as we're talking about hypertension, we all work together. So your healthcare providers can help you with your medication, with your diet, exercise plans, smoking cessation therapies, all again to help reduce hypertension and the risk that it causes to your heart, your eyes, your kidneys, your brain, and your vital organs. So weight reduction is going to be important. Your physician will talk to you about having a healthier weight. So if you think about the fat tissue in your body and how fat tissue can actually compress your blood vessels, so that if you have a beefy arm, adipose or fat tissue on this side and that side can also help compress some of your vasculature and lead to hypertension. So we talked about preload, things that compress your blood vessels or make it harder for your heart to push or cause resistance. We're going to call those afterload. So people that are heavy, that have a lot of adipose or fat tissue around the vasculature, that's going to increase the resistance of your blood vessels or the size of the lumen to get the blood pushed through. So what you'll see is there's a little chart here, an algorithm here, but different doctors may use different algorithms for weight loss. So I would encourage you to follow the weight loss program that your doctor prescribes for you and work with a dietitian so that you're losing weight in a healthy manner. Again, the DASH diet, that's pretty famous for people with diabetes. What you do is you have a lot of fruits and vegetables. You have fat-free or low fat without sugar things in your diet. It's close to a Mediterranean diet. Again, low sodium, low saturated fat. They're going to suggest moderate physical activity. Again, this should be in conjunction with your physician. Probably an exercise therapist or physical therapist will be involved. They will plan an exercise program that is safe and specific to you. Um, they can do muscle strengthening exercises. So when your body builds muscle, it also increases your metabolism and helps you to lose weight and maintain a safe weight. And it's very important to maintain your flexibility and your balance in these activities. So all of these activities are going to help promote a healthy lifestyle as well as decrease your risk or current hypertension. Again, we're going to avoid tobacco products. Again, we talked about there are different, like there's a nicotine patch, which still has nicotine. There's nicotine gum, but there are a lot of programs out there. There's a lot of help for people that want to stop smoking. And again, smoking is very damaging to your body. So it's very important if you have hypertension or if you're at risk for hypertension or just to lead a healthy lifestyle, you're going to need to stop smoking. The psychosocial factors, again, we're talking about stress. Pretty much anybody that lives in the American society is at risk for different types of stress because we are so motivated by the do and the perform and the go that lots of studies show that Americans don't take all of their vacation time. Some people don't take any. We as a society value high performance, hyperactivity. Just look at all the Starbucks on every corner. We live on caffeine. Lots of things in our society teach us that we need to live at that very high level of stress and performance, which is not good for our physical bodies or our emotional well-being. Okay, so drug therapy. We're going to talk about specific drugs in the next couple of slides, but some things that I want you to remember about your drug therapy is that number one, you work in conjunction with your doctor and your pharmacist. So don't take Aunt Helen's medication because you think, oh, I might have hypertension. And true story, when I was working in the emergency room, we would have patients come in that would have this little plastic bag full of medications. And as we're sorting out medications for these little people, they would have medication bottles that had different names on them. And so I might have a little female patient with me and she'll have Henry Morser's antihypertensive medication. And I'll say, oh, well, Helen, why do you have this little bottle? And she would say to me, oh, well, I thought my blood pressure was up and my neighbor said this would help me. So what we're going to remember is we're going to use our medications as our doctor prescribes. If we have questions, we can always talk to our doctor or our pharmacist. We are never going to change the dose of our medication without talking to our doctor. And we're also not going to stop taking our blood pressure medication without talking to our doctor. We're going to follow up with our doctor. Sometimes we have follow-up appointments and people think, oh, well, you know, I'm doing fine. I don't need to do that. It's very important to follow up with your doctor and let them know how you're doing on the blood pressure medication, any side effects that you have. One thing that's important to know is there's a thing when you start taking antihypertensive medications, people are at risk for something called orthostatic hypotension. And basically what that means is when you change positions quickly, especially from sitting to standing, because you're on that medication, your blood pressure can drop fairly quickly and make you feel dizzy. So a very important patient teaching thing is when you're changing positions, do it slowly, especially when you first start on that medication. That's what orthostatic hypotension. Sometimes patients can have sexual dysfunctions, especially men, when they start taking these. Again, if that becomes an issue, talk to your physician. They can make your mouth feel dry, especially if you're taking medications like an ARB, an ARB. We'll talk about what that is. Anything that causes your body to lose a little more water, but that can cause your mouth to feel dry. Sometimes your eyes will feel dry, and it can increase urination. So when typically this becomes a problem is at night. So if the medication that you're taking causes you to be up multiple times at night and you're not getting the sleep that you need, make sure that you talk to your doctor about that. And again, so it's important to take your medication. Usually we have people take them in the morning. If they take it more than once, usually morning and dinner time. Again, we want to avoid those later nights where you're taking the medication and it causes you to lose sleep because you're up going to the bathroom multiple times. Okay, so there are different types of data that your healthcare providers are going to look at. The subjective data, meaning things that we think or feel, and the objective data, which are more like values. So subjective data that we're going to assess, we're going to look at your past medical history, any kind of drugs you're on, your family history, what you feel like your salt and fat intake is, if you're having any weight gain or weight loss, nocturia, if you're going to be up at night because you have to urinate. What's your level of fatigue, dyspnea, meaning when you're exerting yourself, is it hard to breathe? Any kind of palpitations where you feel like your heart is either beating faster or skipping a beat. If you're having any chest pain, we're going to want to know if you're having any dizziness or blurred vision. Remember, we talked about how we're looking at how well is your vasculature and your heart supplying blood to your major organs. So if you're feeling dizzy or you're having blurred vision, that can be an indication of how well your body is supplying blood and oxygen to your brain and your eyes. Are men having any kind of erectile dysfunction? And what you would how you would describe and what you would describe as the stress level of your life. So objective data would be the actual reading of your blood pressure. Heart sounds, so your doctor will listen to your heart sounds to see if they can find any problems related with your heart, meaning maybe valve issues or different arrhythmias. We're going to check your pulses. Typically, we'll check your pulses in both arms and in both feet. We're going to look for edema or swelling in any part of your body. This would give us an indication that you're suffering from any kind of heart failure or just have fluid volume overload. So if you're retaining sodium and water, which is a contributing factor to your hypertension, then you might have edema, like swelling in your feet or your ankles if you've been on your feet all day. We're going to look at different body measurements and we're going to check your mental status. So any changes in your mental status. Are you feeling confused? And again, as you progress with age, the mental status assessment changes a little bit. Okay, so sometimes people have their blood pressure taken. Most of the times it's in your forearm and we measure it right below the blood pressure cuff on your arm. Some patients, if you've had a mastectomy or if you've had kidney disease and you have a shunt in your arm, sometimes they will have to take your blood pressure at a different site. Most people that doesn't apply to unless, again, you've had a mastectomy or a shunt. Most people will have their blood pressure taken in their right or their left arm. When I talked about orthostatic hypotension, where your blood pressure drops when you change positions quickly, what typically you'll do is your physician will have you sit, take your blood pressure, then they'll have you stand and wait 1 to 2 minutes, and then they'll assess your blood pressure again. So if your blood pressure drops more than, we'll call it 20 points, or if your heart rate goes up more than 20 points, then they would diagnose you as having orthostatic hypotension. That's really not a big deal. Um, Typically, they just tell you to change your position slowly. Sometimes, depending on the person, they might have you drink more water because they would think you're a little dehydrated. But again, if your doctor diagnoses you with orthostatic hypotension, it's not that big of a deal. You're just going to change position slowly and follow your doctor's recommendations. So these are what we would like you to accomplish in our collaborative plan of care for people that have hypertension. So we want you to achieve and maintain a normal blood pressure. So normal blood pressure used to be, back in the days, like 140/80. Now a healthy blood pressure is between 120 and 130 systolic, or when your heart is at work, and 70, sometimes to 80 when your heart is at rest. So your doctor will determine parameters where they would like to maintain your blood pressure, but those are typically the normal ones. So it is also very important for you to understand and follow the plan of care that your doctor prescribes for you. So it will probably include medications. So you're going to need to understand, okay, what medication am I on? What's the dose? How often do I take it? What are some adverse reactions that I might see? How might this medication interact with something that I might already be on? Again, don't stop your blood pressure medication abruptly. Don't change the dose of your medication. Back to that little lady, Helen, in the emergency room. She would decide, oh, today I just feel like taking half a tab of my medication. And when I would ask her, well, what made you make that decision? Oh, I just felt like it. So again, listen to your healthcare team. If you have any questions about your medication, you can talk to your doctor or your pharmacist. Again, part of your treatment plan is going to be a healthy diet, which will include the DASH diet or the Mediterranean diet, where you'll have more fruits and vegetables. If you're having fat, it's going to be low saturated fat, like white meat chicken or lean beef. Some people can have lamb or veal, or some people choose vegetarian diets, substitute the meat for tofu. There's all kinds of healthy recipes and things like that that you can do to maintain a healthy antihypertensive diet, and a great resource for that are our dietitians. Exercise, again, is going to be prescribed by your doctor. She will formulate a plan for either healthy weight reduction, healthy weight maintenance, an exercise plan that's not too stressful for you, but that will help you maintain a healthy weight and a healthy physical body. Also, if you're a person that has a high stress level, your physician may either help you with some holistic ways to reduce your stress, like biofeedback, aversion therapy, swimming, massage. There's a zillion resources out there for holistic ways to reduce your stress, or your doctor may refer you to see a psychologist or somebody that you might need to talk to. So again, the goal for people with hypertension is to focus on the patient as a whole, to get you into a healthier state and to keep you in a healthier state so that we can hopefully prevent damage or illness related to hypertension, and you can live a long, healthy life. So our goal is always health promotion. So when you think of health promotion, I want you to think of long, healthy life. So there's a difference between primary prevention and lifestyle modification. So the younger you are, that you start using a healthy diet and healthy lifestyle, genetics aside, the hopefully longer you'll live and the healthier you'll be, so that you can enjoy the years that you live. So lifestyle modification would be where we would tell you to stop smoking, stop engaging in all these activities that can cause your body stress or damage, like smoking, um, high fat diets, poor diets, drug and alcohol abuse, things like that, high stress. Um, so another thing, staying healthy is your doctor will create an individualized plan. Again, that's so important that you have a relationship with your physician and your other healthcare providers where you feel like you can be honest with them. You can set realistic goals for yourself that help you feel empowered, help you feel good about taking good care of yourself and being healthy. Different screening programs. So hopefully you've seen different hospitals or different health organizations doing blood pressure screenings or blood glucose screenings or cholesterol screenings or cancer screenings. So the purpose of all of those are to provide early detection of any kind of problem or diseases and treat those before it becomes a chronic problem. Um, and always, when we're assessing hypertension, we're trying to identify what risk is this to your heart and how can we prevent damage or further damage. Again, just to review, so it's important to have an individual plan of care for your hypertension, you and your doctor. Again, can you include your doctor, your pharmacist, your nutritionist or your dietitian, an exercise therapist, a psychosocial therapist. There's a plethora of people that can be involved in your community to help you be the best you, the healthiest, the strongest, the best you. I also want to encourage you, this might be new for some of us or make us feel uncomfortable. Uh, this is our plan. So we should feel the freedom to participate in that plan. Some people might not feel comfortable with some of the pieces of the puzzle, but I want to encourage people to speak up, work with their physician and their other healthcare providers to provide a plan that A, you're going to use, and B, you're going to feel comfortable with. So your physician and healthcare providers can work out this fabulous plan on paper, but if it's not realistic and it's not something that you're going to be able to do, it doesn't do you any good. So be honest, start with small goals and work with your doctor to be able to have goals that help you be healthy and live long into the future. This is a great thing for RX outreach. Sometimes people can't afford the medications that they're prescribed. And so then again, I know Lisa talked about this at the beginning, but at the end, there's information that she can give you for you or a loved one that can't afford or is struggling to afford their medications. Part of your community to stay well is your caregivers, either your friends or your spouse, your partner, whoever. They should be involved in your healthcare as well as a support system. I'm going to talk about drugs again. Sometimes, most of the time, your doctor may use more than one medication to treat your hypertension. Again, it's important. Take it as directed. Don't stop it suddenly. Don't change it. Talk to your doctor or pharmacist. And I'll go over some specific medications here shortly. Usually, the pharmacist will provide you with a list of information that are important things to know about the medication. If for some reason when you receive that medication, you don't get that list, talk to your pharmacist. It's important for you to understand what medication that you're taking, why you're taking it, what dose you're taking, and any kind of side effects or interactions. Again, my plug for please don't take any new over-the-counter medications or health supplements without talking to your doctor or pharmacist, because sometimes those medications that we think are natural and helpful can cause a reaction with our medication. So please don't take anything over the counter like cold medicines. Cold medicines can make your hypertension worse. So please talk to your doctor about safe medications, like if you would have a cold or allergies, something like that. There are medications that your doctor can tell you, yes, you can take this, it will elevate your blood pressure. And again, another push for please stop smoking. The smoking, the nicotine in the cigarette, not to mention all of the other chemicals that you inhale into your lungs, the nicotine is very damaging to your blood vessels. Again, causes the vasoconstriction, causes your heart to work harder. As you age, the constriction of your blood vessels damages them, and then your heart can't efficiently provide oxygen and nutrients to your body and your organs. Okay, so some common medications that you would see for patients with hypertension. Something called an ACE inhibitor. Again, this works with a special part with your kidneys for an enzyme. It helps your body secrete, it helps your body convert different enzymes in your kidneys so that your body is disposing of sodium and water to keep your blood pressure low. Again, that preload or that volume that comes into your heart. Same thing, diuretics. They work a little bit differently. Beta blockers. Beta blockers work on your heart rhythm, so they slow down your heart rate. They also dilate your blood vessels. Calcium channel blockers. They work on the calcium in your heart muscle to keep your heart rate slow, regular. Those are the most common medications, although your doctor may prescribe other medications. Take them as directed. Any questions that you have, talk to your doctor or your pharmacist. And again, change your position slowly. So don't get up quickly, especially when you first start on that. It could make you feel dizzy and you would be at risk for a fall. One last thing, as we get older, our risk for high blood pressure becomes greater. So the older we get, the more we would be at risk for having hypertension. Usually it starts at 50. Again, as we age, different stress in our life, if we use a lot of caffeine, if we're a smoker, have nicotine, those are all things that are going to contribute to us having hypertension. Again, white coat syndrome, when I talked about first, your doctor's not going to diagnose you with hypertension based off of one elevated blood pressure. We're going to look for a pattern of elevated blood pressure over time. So that's why when you go to the doctor, he'll take your blood pressure, he'll sit and talk to you for a while, and then he'll take a blood pressure toward the end or have a nurse take it toward the end to see if your blood pressure is up just because you're nervous about seeing the doctor. And again, age-related changes. So normally over time, our body progresses from the time we're born toward deterioration. So as we get older, our tissues and our body are deteriorating. Just those normal changes of life over time can also contribute to high blood pressure. Remember when I said our blood vessels get a little crispy? Well, as our heart pumps, our blood vessels expand. So just the use and strain of that over time can cause them to be less elastic, like an old sticky rubber band. So when you have a new rubber band, it snaps really efficiently and strong, but then over time it just gets kind of lax. That's how our blood vessels react over time. And so that's a normal part of our aging process. But with healthy diet, low sodium intake, low fat, we can make our vasculature as healthy as possible. Thank you. That's all I have. Does anybody have any questions?
Hi, everyone.
Hi.
I'm trying to start my video again. Thank you all for joining us. I know we had some people join us a little bit into it, into the presentation, but thank you, Paula, for that really informative presentation. I know that I learned quite a bit, so I
Good.
hope our guests did as well. If you have any questions, please put them in the chat and we'll address them now. If you're new to Zoom, if you go to the bottom of your screen, there's a toolbar. You can kind of hover over it and it should come up. If you're on a mobile device, it might be a little bit different. I'm working from a laptop right now, but click on chat and just, if you could, make sure that you submit it either to RX Outreach Inc. or just to everyone, and then we'll address any questions that you may have. While we're waiting, I just want to remind everybody that RX Outreach has a program that can help you with your medications. We have a formulary that you can find on our website, which is rxoutreach.org. And we offer many medications at reduced or no charge, depending on your situation. Also, our generous sponsor, Pfizer RX Pathways, can also help you with copays or paying for your Pfizer medications. If you need any help with navigating insurance, again, paying for copays or your Pfizer medications, you can get more information at PfizerRxPathways.com. Do we have any other any questions? Okay, I don't see any.
Okay. Thank you all so much.
Yes, thank you all for joining. And if you are interested in upcoming presentations, if you'll go to our Eventbrite and search for RX Outreach, or you can go to our website at rxoutreach.org. You'll see a list of our presentations. Again, this recording will be saved on our YouTube channel for viewing later. And I just want to thank you all very much and thank our sponsors again for their generous support of this program. Thank you, everyone. Have a great day.
Thank you.